Good morning, Facebook friends. Helen Archontou here, CEO of the YWCA of Northern New Jersey. Happy Monday. I hope everyone had a restful weekend, that they're energized and ready for another, hopefully a great week ahead. I know it's going to be a great week for YWTV because we're starting with a really important conversation that I'm so grateful that we're able to share with you. And it's about the welfare of children in New Jersey. And there's so much to talk about in this area. We know that the impact of COVID on the welfare of children here in New Jersey has been immense, but we also know that there's a lot happening around this area. So there's definitely a lot to jump into in this conversation. But with schools closing and opening and closing, and what we keep seeing in that realm, and we are all, those of us who have children, are obviously concerned about the lasting effects on the developmental needs of children, about what's happening around us, for sure. And I can't think of anyone better to talk about, the impact from a systemic perspective of what's going on children and families than our guest today, who is Cecilia Zalkind, who is the president and CEO of the Advocates for Children of New Jersey, which is known as ACNJ. She is we're so grateful she can make the time to join us this morning. She will talk with us a little bit about the work of ACNJ, which anyone who, like myself, who is spent their career working around children, uses this organization and the work that Cecilia and her team does, as our measure for our grants, as our measure for our discussions in our community, as our measure for program planning. They work so diligently, and they're so committed to implementing change in laws and policies to offer more effective and stronger services for children and families. So before we jump in, let me tell you a little bit about Cecilia herself. She has been advocating for children in New Jersey for more than 30 years. She's the president and CEO of ACNJ, and she always has an ambitious agenda for the organization because of her commitment to children, for sure. She has secured measurable gains for children in many areas of child well-being, including early education, health, nutrition, child welfare, and juvenile justice. She has led critical coalitions to advance early education policy in New Jersey, and is currently heading ACNJ's Birth to Three initiative, Think Babies. She holds a BA and an MA from NYU, and she also has a law degree from Rutgers. And with all of that, she is just a force here in New Jersey. She's a personal hero of mine, which I don't know that she knows, but I can share. She's someone who has always inspired me when I think about my career and, how I want to see it go and the impact I want to have. So thank you for joining us today.
Thank you so much for having me. It's really a pleasure to be here.
So let's start with telling a little bit about ACNJ and the work of your important organization.
So ACNJ was incorporated in 1978, although we have a history that goes back in Newark to the 1850s, and the Newark Orphan Asylum, and then a private foster care and adoption agency, the Child Service Association. In 1978, two boards merged to form ACNJ with the idea of advocating on the policy level for children. After 100 plus years of direct services, I think the lessons learned were that we could do better for kids on a policy level. So we were formed to do research, data analysis, looking at all aspects of child and family well-being, not to provide direct services, but to look at those broad issues that impact on families and see if we could bring about system change to improve policies and programs. I think, to me, one of the strongest features of ACNJ, strongest characteristic, is the fact that we're independent. We don't accept any government funding, which gives us the ability to basically tell it as we see it, which I think has made us a force. Also, we don't advocate alone. I see us as the facilitators to bring together community agencies, parents, all individuals who are impacted by our state systems, and basically give them a voice.
Well, and I think one of the things that I'm always most struck with about the work of your organization is not only your, impressive ability to, from a policy and perspective level, like look at the big picture for children, but you also drill down into counties, so, and not only a state perspective through your kids count report, which I actually not only use in our grants and, use in our program planning, but I'm a professor at Montclair State, and I use it with my students every year for them to be doing their research as well, because there's so much good information in there. And I do encourage everyone to just go take a look, because you may not even know or understand what's happening in the state for children, or what's happening right in your own backyard, until you really look at the data that you collect annually, which is amazing that you're able to put that together and create that baseline and that ongoing report card, for our government and for our state everywhere.
Yes, we're very proud of our Kids Count initiative. The NEA-Casey Foundation launched Kids Count. We were one of the first grantees to try it out, and we do produce a data report on children across the state by county and in some communities. We've done a Newark Kids Count report and most recently a Trenton Kids Count report. And as you point out, it's a way to gather data together on child well-being across a number of issues: health, child care, child welfare, education, juvenile justice, and really give a longitudinal view of how kids are doing. And I know I'm always happy to hear that people use it. We've heard that people use it in grant writing. We've heard that people use it in program development. And we certainly hope that our state leaders use it as they develop policies.
Well, I hope so too, for sure. And you also provide some, I know I always send families to go to your website and talk with you too about resources, especially with children, that are having challenges in their school district, to help navigate those. Can you talk a little bit about those resources for parents that may be watching as well? Because I don't know, I just want to make sure that people know all you do.
Sure, I'd be happy to. As I mentioned earlier, we're not a direct service agency, so we don't really have a client base. However, a number of years ago, we had the opportunity to develop what we call our case advocacy in education. And we have an attorney on staff who handles calls from parents who are struggling with issues primarily around school exclusion, access to special education services. We handle at least 400 cases a year. And we are very successful at mediating positive results. If a case goes on to court, we turn that over to either a private attorney. Rutgers has a special education clinic, but I think this has emerged as a very valuable resource. One, I know it does help parents, and we hear from parents all the time, but it also helps inform our agenda, so that we know that the policies we're advocating for are actually grounded in things that parents need. We also talk to people about child welfare issues as well. We often hear from kinship caregivers, parents, resource parents about help with the child welfare system.
Well, and for those of you watching, we have the link in the comments for you, and we've been putting it across on our screen so that you can learn more directly about the services and the reports and the programs that ACNJ have for you. And also, I encourage you to follow them on their social media platforms, because there's always a lot of posting and advocacy there that you can get involved with, which we'll get back to before we end today. But now, let's talk a little bit. I mean, obviously, we've been now living in this pandemic for a year, which is unfathomable, but true. In some ways, it's gone quick. In some ways, it's been, taken very, very long to get through each day. Can you talk a little bit about how you feel that this time has really impacted children, and the concerns that you and ACNJ have that you've been speaking about?
Well, it would be an understatement to say this has been a challenging year for everyone. But I think especially for parents with young children, school-age children, parents who are vulnerable either economically or because of family issues, it has been an incredibly challenging year. We have certainly seen levels of food insecurity that I don't think we've ever seen before. We know that parents have lost jobs, that parents are struggling with the demands of working remotely at home, but also helping their children who are in school remotely as well. And we've certainly seen major challenges to our childcare system, which has been a big focus of our advocacy this year.
So let's talk about that. Let's talk about the childcare system. And I know that we watched and read a report that came out in December. That talked about how women were most severely impacted, and specifically BIPOC women, from what's been going on over this last year and the crisis. And so much of that crisis is linked to childcare. Let's talk about that crisis a little bit for our viewers.
So
and many of them are living it, so we're basically
yes.
telling them, before we got on, we talked about how any moment my kids could run by because we're all, we have something going on in our homes other
Right.
than work.
So I think more than anything, I think people have come to understand over the last year how critically important childcare is to parents, certainly, to communities, to our state economy. People cannot get back to work without childcare. And as you point out, in New Jersey and across the country, women are a significant part of the workforce. So to be able to maintain that workforce, childcare is needed. And I think, the childcare system initially was hit hard. This is a system that was struggling before the pandemic, a system that is underfunded, operates on a shoestring. If you talk to any childcare center director, they would have told you before the pandemic that they have insufficient funding to sustain them for more than a few weeks if something were to happen to their base, to their parent base. And that's exactly what happened. Initially, childcare was kind of left out of the mix. Schools were closed immediately, no direction on childcare, lots of confusion about whether childcare should remain open, closed, was it safe? If it closed, what would parents do? And then ultimately, Governor Murphy ordered that childcare be closed, but that the state also develop emergency care for essential workers. And I think, to its credit, our State Department stepped up and created emergency care so that our hospital personnel and other emergency workers could work. Childcare then reopened in June under very changed circumstances. Health and safety standards changed to address special care during the pandemic. Supplies, cleaning supplies, protective gear were all an issue. And childcare reopened with a much reduced number of children. So group size was much smaller to accommodate social distancing, and also how programs operated. Parents were not allowed to come into programs. Very different climate. So I think two things happened. One was that the federal government passed the initial CARES Act last summer, and I think our state used the CARES Act funding for childcare in a way that not only has sustained childcare, but provide some direction for what we need to do in the future. And then, even more importantly, I think our childcare community stepped up to this challenge. Yeah. We all talk about how we were required to change overnight in terms of how we were doing our work. And I think that applies in extraordinary ways to the childcare community, whether center-based care or home-based care. They were required not only to make major changes, but to do so immediately so that they could support the children and families they serve.
Well, and an absolute shout out to all of our childcare facilities and workers across the state, because I agree. And even, we are at a different level at the YW because we do before and after care, childcare, but it's no small feat figuring this out and having to do it in a way so quickly, and, being able to support families. And I know financially, all of our organizations and our childcare facilities are really struggling, because of the fact that our censuses are different because of what's happening. But yet, our commitment to the families that we work for is, keeping us focused and going. So I know that this has been an interesting time. Our governor announced in the state budget some news, around supporting this area. We just had the American Rescue Plan also announced. Can you talk a little bit about, what's coming and what's happening and how that could impact all of this?
Sure. I think our state saw a big infusion of funding in the CARES Act last summer. And then there's been two additional infusions of federal funding, one at the end of December when the federal budget was passed, and now with the American Rescue Plan. I think the money that the state received through the CARES Act, and more importantly, how our state agencies use that money, help childcare survive. That money was used, one, to do a very important change in payment policies. Programs were paid on the basis of enrollment, the number of children who were enrolled in their programs as of March 1st, whether or not the programs were open or closed, and whether or not they were able to return to full size. This, of course, is payment for childcare vouchers. So we have families in our state who, because of income, can receive some financial assistance. So programs that provide care to children receiving child care vouchers were able to be sustained with that federal money. That money was also used for programs, subsidy and non-subsidy programs, to purchase protective gear, and also to help pay higher rates to support the reductions in group size. I mention all of that because it is very positive childcare policy that actually would have been very helpful even before the pandemic, but was absolutely essential after the pandemic. And then I think the last thing that the state did in the fall, all of which has been sustained, was to extend assistance to families who all of a sudden were struggling with childcare demands because of school not reopening. So the state provided a tuition reimbursement program for families with incomes up to $150,000 a year to get some help in paying for childcare, whether that was full-time childcare if school systems were entirely remote, or after-school care for systems that were doing a hybrid or a fully open model. These are all, I think, very positive steps that our state took to help families and to help childcare. They've been sustained. The additional federal money has sustained them. And we now have more money coming into the state, which gives the state an opportunity to maintain those policies. But I think from our perspective, those help with the emergency, right? Looking long term, what do we need to do to reimagine childcare, to build a system that all families need, that we needed before the pandemic, and that the pandemic highlighted the fragility of. So I think the federal money is a godsend to New Jersey and every state. And I think this new infusion coming in offers opportunity to continue some of that positive effort, but also to look at what do we need to do, and even more importantly, how is New Jersey going to sustain that? Federal money will go away in 2 years. How is this? This is not the time for the state to say, well, we don't need to do anything because we have all this federal money coming in. This is the time for the state to start planning and investing in the child care system.
And I couldn't agree more. And, I know that you have mobilized an effort, to really look at that. And a few, I don't know, the days escape me now, if it was weeks or months ago now, we did gather with my YW sister associations and talk a little bit about childcare in New Jersey and the Reimagining Childcare campaign that you kicked off along with some amazing partners. Can you talk a little bit about that? Because I'd love for our viewers to learn about it if they don't know about it, and connect with you, because there is such an opportunity for each of us to get involved and make great change by supporting this effort.
So in the fall, we launched Reimagine Childcare, which is an advocacy campaign to call attention to childcare and what we need to really build the childcare system of the future. It focuses on improving the quality of childcare for infants and toddlers, also developing more capacity in childcare, and also supporting the workforce more successfully. It is a campaign for everybody, and it is a way to talk about how do we build back childcare in a better way. We have gotten the word out. We've used the phrase with our state leaders. We've signed on organizations and individuals who are interested in hearing more about the campaign and learning what they can do to advance childcare. And we've used the campaign to support initiatives like the way the federal funding has been invested in New Jersey. And now as we're looking at the state budget, what is there in the state budget that will support childcare in addition to the federal money? Reimagine Childcare has its website, reimaginechildcare.org. And I'd urge people to check it out. There's information about what the goals of the campaign are and also how people can get involved. And things change every day. It's a lot of social media. We ask people to get out, to reach out to their legislators. All of that information is on the website.
And for those of you watching, we just dropped the link to the reimaginechildcare.org website in the comments here. We encourage you to connect to it, and then also connect to the opportunity to hear about the different alerts and ways that you can participate. And whether you're connected to an organization and you can formally sign on, or whether as an individual you just want to make your voice heard, there's a place for everyone, and we should absolutely be thinking about how to get involved and how we can support. Any last thoughts to share with our viewers around this topic? And I in my mind, it's been such a obviously terrible time and so much trauma and so much loss attached to it. But we could only hope that good is able to come in long-term change in areas, like you said, that we know have been broken for so long, that this is an opportunity. And we have the pieces in place now to build forward. So I do hope that, and the YWCA of Northern New Jersey and I'm all in to support what we can do in our space and help amplify these messages. But it's definitely a reckoning, and we're here.
Yes. And we're looking at the state budget. This year's budget that was introduced by Governor Murphy in February is now under consideration by the legislature, has some very exciting opportunities in it. Some related to childcare. There's an increase in childcare subsidy to address the continued increase in the minimum wage, which is positive. But there's also other initiatives, Cover All Kids on Medicaid, which will provide health insurance to the 88,000 children in our state without health insurance, and also about $60 million to implement the Nurture NJ plan, which has been developed to address Black infant mortality and maternal morbidity. This has been an initiative that our First Lady has led, and I think it has so much positive potential. So this is a good budget. I would say everybody should step up and let their legislators know that they support it.
Well, you heard that, folks. Again, I always say I always talk through our broadcasts about how everyone we talk about getting people to go vote, but this is a year-round engagement. Once you put people in office, then you have to tell them what you want them to do. They work for us, as I always say, and we have to remind them that. I tell that to my students, and I tell that to our viewers. So these are the kind of things you want to be calling and telling them about. They should be important to you because whether it's for your family or the families around you, this makes a difference for our entire community or an entire state to be well funded and smart programs and smart policies, in these areas for sure. So with that, I want to thank Seal so much for being with us today and sharing this information and opening our eyes to so many great opportunities that we have in front of us and our ability to get involved with them. And again, we have all of the links here for you to connect to their websites. I encourage you to follow all the social media platforms as well and stay engaged. As for us, YWTV will be back throughout the week. I'll see you on Wednesday. We'll have Yana Rogers, who's a professor in the Department of Labor Studies and Employment Relations and the Department of Women and Gender Studies at Rutgers University, to talk a little bit about the state of women. As we know, we're in Women's History Month, so although at the YW, we're always talking about women and the important policies and initiatives and days. But we will be definitely having a great conversation with Yana on Wednesday. And on Thursday, as you all know, that's when we share the mic now with Black women in our community and use this platform to amplify their voices. So we'll have another great conversation with you then. And on Friday, we'll be talking with Dee Waddington about women in sobriety and a wonderful program that exists and ways that you can connect to it if you need it as well. And We have our Women's Leadership Conference series happening right now. As we know, we couldn't gather together as we normally do, but we broke it down into some wonderful conversations. If you joined us so far, we had Dr. Chris Purnell, Janine LaRue, Dr. Valpreet Graywall-Verk, and we will not disappoint with our last in the series, which will be fashion designer Rachel Antonoff, which is on Wednesday evening at 7 p.m. There's no charge. You just have to go to, the link is here for you. We've already dropped it in, so you can register and join us on Zoom for a conversation there. And we do encourage everyone to keep thinking about our Your Story program, which is an opportunity for you to develop your voice and your story. We have a wonderful, talented volunteer, Rachel Brenner, who's been doing a weekly journaling workshop with us. We know how important it is for women to be able to capture what's on their mind, to be able to share it. And so we have a great opportunity. We've had such wonderful feedback from that. So thank you so much for being with us, Seal. Thank you to our viewers for joining us today. We wish everyone a wonderful week. And we've given you some great action items here today. Please make sure you go sign up and put them on your list of things to do. So with that, thanks, Seal. Be well.
Thank you very